Hi, this is Dr. Thomas Lembo. I'm a board-certified podiatrist. In this recording, I'm going to talk through bunions, what's really going on beneath the surface, and what actually helps from a practical, conservative standpoint. Bunions are one of the most common reasons people ask why the side of their big toe hurts, even after switching to wider shoes or trying padding. A bunion, medically called hallux valgus, is a change in the alignment of the big toe joint. Over time, the big toe slowly drifts toward the second toe. At the same time, the joint at its base angles outward. The bump you see is not extra bone growing. It's the joint moving out of position. Pain can come from shoe pressure, inflammation, joint irritation, or overload of the surrounding tissues. What often goes unaddressed is why that joint keeps getting stressed in the first place. After more than 2 decades of treating bunions, one pattern shows up again and again. When we focus only on the bump itself, relief is usually limited. When we look at how the foot functions during walking, things become much clearer. This brings me to a mechanical issue most people never hear about. A major contributor to bunion pain is overpronation. Pronation is the natural inward rolling of the foot as you walk. Some pronation is normal and necessary. Problems arise when the foot rolls inward too much or stays there too long. When that happens, the arch collapses more than it should. Body weight shifts toward the inside of the foot. That repeated shift places stress on the big toe joint. With every step, the joint is pushed slightly out of alignment. Over time, that stress adds up. And I often explain it this way: the bunion is where the pain shows up, and the way the foot moves is often why it keeps coming back. That does not mean everyone with a bunion overpronates, and it also does not mean pronation is the only factor. Genetics, ligament laxity, foot structure, and shoe choices all matter, but mechanics are frequently overlooked. And when they are ignored, treatment often falls short. Bunion patients do not all look the same. Some people have a noticeable bunion that barely bothers them. Others have a smaller bump but significant pain. In many of the painful cases I see, excessive inward collapse of the foot is clearly part of the picture. One patient had tried wider shoes, padding, and toe spacers for years. Those helped with rubbing, but the soreness always came back. When we focused on stabilizing how the foot functioned during walking, the joint stopped getting overloaded with every step. Over time, symptoms improved. Another patient was very active and worried the bunion was worsening quickly. What stood out was not the size of the bump, but how unstable the foot was during gait. Once that instability was addressed, the joint calmed down, even though the bunion itself did not disappear. These situations are common. Many bunion treatments fail because they focus only on what you can see. Toe spacers can temporarily reposition the toe, but they do not control how the foot moves. Padding reduces friction from shoes, which can help, but it does nothing to reduce joint stress. Stretching can improve flexibility. But flexibility without stability often does not change symptoms. Wide shoes matter, but shoe width alone does not correct faulty mechanics. I tell patients this often. If the foot keeps collapsing inward, the joint keeps getting stressed. No matter how roomy the shoe is, the goal of conservative care is not to force the bunion back into place. The goal is to reduce abnormal stress on the joint. That usually starts with addressing how the foot functions during walking. In practical terms, that often means supporting the arch, so the foot is not collapsing inward with every step. When the foot is more stable, the big toe joint is not pushed out of alignment as aggressively during daily activity. When mechanics are addressed early, symptoms are often easier to manage. In some cases, this may also help slow progression over time. That is not guaranteed, and results vary, but reducing repeated stress on a joint is rarely a bad strategy. When bunion pain is tied to excessive inward collapse, my focus is on reducing the forces that keep irritating the joint. That thinking is what led me to help design Samurai insoles. I wanted something that provided meaningful support without being bulky, rigid, or difficult to wear in everyday shoes. Samurai insoles are designed to support how the foot functions during normal walking. They are not meant to act as a brace or a medical device. For people whose bunion pain is related to overpronation, that kind of support can reduce ongoing stress on the big toe joint. They tend to help people who notice their feet roll inward, who feel soreness at the big toe joint during or after activity, and who want a conservative option before considering more aggressive care. They are not a cure. They are not a replacement for medical evaluation. They are simply a practical tool aimed at a commonly overlooked issue. Long-standing pain that does not respond to conservative care also deserves closer assessment. Arthritis, nerve involvement, or structural differences can change the treatment approach, and those details are best evaluated clinically. Many people live comfortably with bunions for years when foot function is addressed thoughtfully. You do not need to panic, and you do not need to ignore the problem either. Understanding how your foot moves is often the first step toward feeling better. In my experience, that clarity alone can change the trajectory for many people. If you focus on support, stability, and reducing unnecessary stress on the joint, you are moving in a sensible direction. If you'd like to read the full article or explore related topics, you can find them on samuraiinsoles.com. Thanks for listening.